really just having that understanding of, you know, their own cultural beliefs and what they specialize with or what they help in, you know, their healing processes. Getting an idea of that, but also adding on the medical part of it.
You really need to study up on the areas where you're going. Learn a little bit before you go, and then once you're there, keep on learning.
So I'd say the thing about housing for nurses when they're going to some of these facilities is just being flexible with the housing, because they're not always like 5-star hotels or anything like that, or they're not you know, always super fancy or maybe what you're absolutely used to.
Getting to know the tribes that you're, you know, going to be working with. A lot of tribes do practice traditions differently.
When you are working in one of these critical access facilities, you're gonna see anything from, you know, a scraped knee to a gunshot wound or a really terrible car accident. I think the hands down most important thing to know for our nurses going out is that they're not going there to change the entire system. They're going to these facilities in these communities and meeting these patients where they are.
So one of the main things I would definitely recommend, even on your days off or weekends, you know, going to flea markets, getting involved with community, asking questions more about, you know, places.
It's always okay to say, hey, how would you prefer to be treated, or how may I call you?
Just going into a community, you know, listen, learn, understand, and respect their cultural beliefs.
The only way you're gonna do that is by listening. You have to kind of just ask a question and then sit back and listen to the answer.
I definitely think one of the biggest opportunities is just to develop relationships with so many great people, because like I said, a lot of people are coming here with the mentality to serve, so you're going to run into a lot of amazing people.
I would recommend probably even just, you know, building that rapport with patients. You're in a small town, you're dealing with, you know, it's the same type of environment, same type of people. You're probably going to see the same people every day.
Stay humble, stay focused on what you're there for, and you know, when in doubt, ask.